Have you experienced vertigo, equilibrium, or dizziness issues? Have you even gone through traditional treatment options such as the Epley's maneuver to find help for it, but yet you're still dealing with the same issues? What if I was to tell you that there might be something that you haven't looked at up to this point in time? About 20 to 30% of people will have a periodic vertigo episode. As we age, it becomes more common that we could experience that. And as there can be a number of different reasons why we can have an equilibrium or dizziness issue, oftentimes the main reasons or causes are overlooked. What are some of the most common causes of equilibrium or vertigo issues? Well, it could be a cardiovascular issue. We could have an arrhythmia, we could have a blood pressure issue. Sometimes I've actually seen a lot of patients who have an equilibrium issue because they're on medications that are making their blood pressure too low. Those can be options. There can also be neurologic problems. A migraine headache can have dizziness associated with it. So can other issues such as multiple sclerosis. So different neurological problems. But the most common causes are usually inner ear or vestibular problems. And so most people are familiar with a procedure called Epley's maneuver, a kind of a retraining of the crystals in the ear. However, most people are unaware of something called the atlas subluxation complex, an injury that can happen to the head and the neck, therefore putting pressure at the base of the skull. That pressure at the base of the skull can affect our vestibular system and create equilibrium problems. This is the part most people are unfamiliar with or haven't heard of. In 26 years of clinical practice, I've taken care of countless patients, hundreds and hundreds of patients with equilibrium or vertigo or dizziness issues who found that the solution for the problem that they had wasn't Epley's maneuver, it wasn't a medical high blood pressure issue, but it was really an upper cervical problem that, once properly corrected by a board-certified NUCCA doctor, allowed for them to recover. So if this is something you're unfamiliar with, I would encourage you to check out that number or click on the link below to find out more about our office.